Tell me a little bit about your journey to get to this role. Tell me a little bit about your background.
Yeah, indeed. So I'm a family medicine trained physician who came to the Rochester area to complete a fellowship in preventive medicine and public health. This was a residency program through the University of Rochester in the Department of Public Health Sciences. So in that training, I got my Master's of Public Health, and every preventive medicine residency program has a rotation for their physicians to work in their local Department of Public Health. So I got to come spend 4 months learning what the Monroe County Department of Health does to support and protect the health of the community. I loved it. And then when I graduated, there was an opening for the Deputy Commissioner position. So I joined Monroe County in that capacity as the Deputy Commissioner in 2016. I've been here ever since, and I stepped into the acting or interim commissioner role back in March.
What about Monroe County has made you want to, climb up the ladder and achieve all these feats?
So there's two parts to that question. So my interest in public health is born out of a concern for how to meet the needs of folks that perhaps have been overlooked, or communities or populations that have been underserved or disenfranchised. So that led to my interest in going into medicine, in family medicine, where I thought I would be able to try to help keep folks healthy. Unfortunately, the way our healthcare system is set up in the United States, there are a lot of barriers for folks to even come in to get their general health taken care of, preventive screenings, for example, transportation. If someone had insurance to come and get to my clinic, if they have a job that gives them time off to attend to their healthcare needs, there were a lot of ifs that folks had to overcome in order to actually even see me in my office. So oftentimes folks would only really have the bandwidth to come in and be seen when they were already sick. And I didn't have the language during my family medicine training to really understand that my interest lies in all of the other non-medical social drivers of health. So things like, are you employed? Do you have enough food? Do you live in a safe housing? Are you free of intimate partner violence? All of those other non-medical things absolutely impact whether someone is going to be able to be healthy or develop illness. And so that's really where I wanted to focus my work at more of an upstream kind of policy systems level, where we can make changes that are going to impact the entire community, regardless of whether you have transportation or you're employed or you have insurance. So that's my professional interest. And then Monroe County and the city of Rochester are just a lovely little city. I'm from Philadelphia, so I'm used to a slightly bigger population center, but the degree of cooperation that I've found here has been astounding. And certainly that was highlighted during the COVID pandemic, where the two health systems and so many other community partners came out of the woodwork to really work together and try to prevent more illness, more hospitalizations, more deaths. And I can't imagine all of the different competing health systems in a city like Philadelphia being able to achieve that kind of putting aside their competitive nature and really just coming together to support the community. So I found this area to be just people really generous in terms of just donations and financial fundraising in general, and that same spirit of being willing to serve and help their neighbor is really refreshing. So that's what's kept me here.
Getting adjusted into the new role, what are some goals you've started thinking about when it comes to Monroe County?
Yeah, so I've got lots of dreams and hopes. I think the main thing that I would like to do more work in is to support the mental health and behavioral health aspects. There is a Monroe County Office of Mental Health, and so we already work with those colleagues, and April Aycock is a fantastic colleague and really easy to work with. But there is such a need to address adverse childhood experiences and try to prevent traumas at an early age, because we know the data are very strong that when people experience really frightening, concerning events that make them fear for their own safety or the safety of a loved one before the age of 18, the more of those experiences that someone has, the more likely they are to develop diabetes and hypertension and dementia, all these things that you wouldn't think had to do with your experiences growing up. And so I would love to be more involved in preventing ACEs and early traumas, and then helping build a system that more equitably supports folks and helps them heal after something like that happens.
What so far, did you have anything written down so far that you wanted to touch on that I haven't yet?
Yeah, I think I certainly want to support my staff in continuing to do the excellent work that they already do to try to help make Monroe County and even just the physical environment safer and healthier. I'm excited to bring a public health lens to different conversations about those social drivers of health, whether we're talking about poverty, whether we're talking about educational disparities. The public health lens is very much a data-driven approach to look at a problem, kind of analyze who are the stakeholders, bring and convene lots of smart people coming together, whether that's researchers, whether that's funders, certainly including members of the community and impacted populations, together to come up with the best solutions to try to address this problem, and then think through what are going to be the outcomes, what are the metrics, how are we going to measure success, whether this idea or initiative actually worked or not. And so being able to bring that kind of a systematic approach to these big social drivers of health is something that I really look forward to doing.
Just want to check my notes for questions. I'm trying to think. What so far do you think I'm glossing over that you think is important to touch on? What do you want the community to know, you know, when they see this, that you're going to do for them?
Yeah. So I would like the community to remember that public health probably saved your life today and you didn't even know it. So my staff are doing work every day inspecting restaurants or doing home visits with pregnant people and supporting them in their whatever their health goals are for pregnancy or the first 2 years of their child's life. We're already supporting so many folks addressing food insecurity through our WIC programs that we are here to serve. We are here to help make the healthy choice the default choice. So certainly supporting my staff to help them do the excellent work that they're already doing and amplifying that reach, that is one of my goals.
What so far do you think I'm glossing over? I feel like there's probably a few more things we might be able to put on, or?
There's so much stuff that we do. I'm trying to think what would, so I would certainly want to make sure that everyone in our county was aware that we have our immunization clinic to help support kids getting up to date on their school mandated vaccines. We're certainly happy to provide COVID and flu and RSV, other vaccinations that are optional, but really good ideas for the general population, certainly for more high-risk populations like some of our seniors, pregnant people. We have I already mentioned our WIC program. We were just happy to celebrate an expansion of WIC benefits being able to be used on the FoodLink curbside markets in all of their locations. And so I would actually ask folks to consider whether they might be eligible for some of those benefits and not even know it. While the name of the program is the Women, Infants, and Children Supplemental Nutrition Program, it is really a program designed to support anyone, fathers, grandparents, any caregiver of a child birth to age 5, to really just try to support folks in the challenging work sometimes of providing food for your family. So more folks are eligible than realize, and so I would recommend you go on our website, pick up the phone and just inquire about your eligibility, because we want folks to get the benefits that they're entitled to just be able to put healthy food on their family's table. Some folks are often surprised to find out about the breadth of environmental health programming that we have. So some folks are familiar with our rabies program, where we run clinics where, you know, cats, dogs, ferrets can be vaccinated at no charge. But anyone who is scratched or bitten, whether it's by a wild animal or a domesticated animal, we are here to support you. We have staff that are trained to help folks know whether they need treatment or not. It's really important to make that call, because if someone is exposed to rabies and you don't get treatment, that is universally fatal. So we want to help folks stay healthy and avoid an avoidable illness. We have ways of monitoring domestic animals, so it's not necessary to sacrifice a pet to determine whether you've actually been exposed, and our staff are very, very skilled in helping folks navigate what can be a very stressful situation of a potential exposure either to a bat or to a scratch or a bite. Our team also does all kinds of inspections, not just of restaurants to keep people healthy when they're going out and enjoying, food that you didn't have to cook for yourself, but also checking water quality, inspecting beaches and determining whether it's safe for folks to go swimming or not when the weather is a little warmer than it is now. There's a lot of environmental evaluations that my team is doing just to make sure that the environment is safe for folks to go out and enjoy as well.
All right, fantastic. Do you have anything?
I was just going to add, I guess personally in your career, this is a big moment for you, right?
It's huge.
So how does it feel to be able to provide all these services and be the leader of this amazing team?
Yeah, so I am very proud of the work that this team does. A lot of it is behind the scenes and folks aren't aware, but for me personally, to be the first woman to be the head of this department, to be the first woman of Hispanic descent to be in this position, I'm incredibly proud of that achievement. I am incredibly grateful to have had the support of family and so many other colleagues and community members that have been cheering me on to get to this point, and I am excited to continue to advocate for communities that maybe don't speak English as their first language, folks that are living in zip codes or areas of poverty. We know due to historic and structural racism that is more likely to be communities of color, Black and brown and immigrant communities. So I am very excited to continue to try to make sure that those populations are at the forefront of these conversations, because they're often the most overlooked but the most highly impacted populations. So that has particular relevance to me just based off of my family's story. My family's from Puerto Rico. I was born and raised in Philadelphia, but my grandmother still doesn't speak English very well. So thinking about, could she understand this health-related information and make the healthiest choice for herself, for the rest of her family, that helps kind of guide and drive a lot of the work that I do. And I'm pleased to say I wasn't the first one to think about that in this department. We have a very robust linguistic accessibility policy and a mindset to make sure that we're not leaving folks behind.
Perfect.
I had another thought. I didn't mention EI preschool. It's such a hot button topic. But my department is also responsible for kind of coordinating and managing the early intervention and preschool special education programs. So we are pushing our state partners to make it easier for speech and language pathologists, for occupational physical therapists to provide the youngest members of our community with the therapies that they need so they can catch up in their developmental milestones. The data are very clear that if we can help kids who are behind in those milestones catch up, then they do so much better in terms of academic achievement and progress that feeds into the types of jobs and programs that they can access later on in life. So we are working in a very challenging circumstances to make sure that the families and our youngest, most vulnerable populations can get the support that they need.
You got a lot of good information here.
Yeah.
Anything else you want to add?
Ugh, all the addiction work. How do I encompass that in a 30, 20 second, 10 second soundbite? My team is also doing very important work to address the opioid epidemic, whether that's moving forward with new partnerships with school districts to really prevent young people from ever starting to use substances, or covering the entire county with as many doses of Narcan as we can and making them accessible inside businesses, on the corner where we know that other overdoses have happened in the past, and doing outreach to folks that have survived an opioid overdose and trying to educate them, inform them about harm reduction strategies that they can use, but also just connecting to treatment and helping folks survive to get that next chance to connect with a therapy, a treatment that will help them get into a stable recovery. And a lot of the work that we do also is just to reduce the stigma around substance use disorders. There's so much judgment and stigma around mental health conditions in general and substance use disorders specifically, but a substance use disorder or an addiction is not a lack of will or someone just making bad choices. There are so many other social factors that can feed into a choice to use a substance, but ultimately it is a chemical change in one's body. It changes the brain to use some of these substances, and it makes someone need to have that substance again, or they feel sick, or they go into withdrawal. So anything we can do to break down that stigma, we are pursuing all of those avenues, and we've benefited so much from so many community partners in law enforcement, and so that is a huge topic that I'm really proud of the team that we've pulled together to just chip away at one part of it and address that crisis as we can.
I'm glad you brought that up. I think that's very important.
Yeah, that's huge.
The stigma surrounding it.
Absolutely.
All right, great.
Public health preparedness. So a lot of folks are unaware that we have an Office of Public Health Preparedness where we have plans to know how to respond quickly in case of either a natural or man-made emergency. So if you think of the swine flu, this current concern about highly pathogenic avian flu, we have plans for how we're going to respond if there's an outbreak. We have contacts with our healthcare providers and others to bring flu vaccination to homeless shelters, to other places where populations don't have the best access to these resources. And we have plans if, someone sprays anthrax at the Lilac Festival, we have plans that we've already thought through for how could we get folks their first 10 days of treatment. So again, folks don't know that we do all this work in the background, but there's a lot of coordination with so many partners just to be able to respond quickly. And having had those exercises and gone through the motions with those partners helped us be ready when COVID hit, when the smoke from the Canadian wildfires, how do we inform and educate folks? We already had plans that we could adapt and modify. And certainly there's always room for improvement, and COVID was a crazy time here. And we have learned and made adjustments to some of our plans based on that, but I would hope it would be reassuring for the community to know that we're ready to respond when those kinds of big events happen.
Obviously, as a resident, you would hope someone coming into your role would have the knowledge that you do, but I think it's very admirable, the passion that you have as you describe each one. I think it's just great, like the knowledge you have with it and the passion with it. I think it's going to be, important as people, learn about you and learn about what the county has to offer.
Well, it's easy to be passionate about this work when I have such a great team. We've got 270 some odd folks that are coming into work every day to just try to make this community safer and healthier for everyone, and focused on health disparities and equity and making sure we don't leave communities behind that have kind of been overlooked in the past. So I'm just so grateful for the team that we have here.